I'm very angry. 16 years before my daughter was born, they knew about it and nothing was said, not a thing.
Thalidomide worldwide was about 10,000. We're talking about potentially double that. It's amazing that it's gone under the radar for so long.
He's so unhappy, he just wants to be able to live the way other kids his own age are living.
It's been called a bigger scandal than thalidomide, but one you may never have heard of. For decades, women were taking an epilepsy drug during pregnancy without being told it could harm their babies. How long were the dangers known about, and why weren't they told? I'm Lucy Watson, and this is What You Need to Know. Well, joining me is Christine Alsford, social affairs correspondent at ITV Meridian. Now, Christine, just tell me, well, first of all, give us the name of this drug and what does it do? What was it good at?
Well, it's called sodium valproate. It's been available in this country for around 50 years, and it's very effective at controlling epileptic seizures. But what women weren't told is that it also has an increased risk of birth defects. And that's where the problem comes, women not being informed about the risks they were taking.
How did you find out about it? Because, I wholeheartedly admit I'd never heard about it.
Well, probably until about a year ago, I'd never heard of it either. In a sense, it's been a scandal hiding in plain sight because it's been going on for so long. But I was covering some other stories about women's health, and I heard sodium valproate mentioned and thought, what is that? I need to find out more about that. And then contacted the women and hearing their quite harrowing stories.
I mean, I have watched your report, and it's the first time that a story that we've done on What You Need to Know has genuinely reduced me to tears. I found it very, very emotional. And mainly perhaps because the women who it's affected were so incredibly strong and articulate, and their children too. But what were the dangers that these women faced by they all suffered from epilepsy, maybe different degrees. What were the dangers that they faced basically by taking this drug?
Well, we've certainly known since the early 1990s that there is a 1 in 10 chance of a woman who takes this drug that they will go on to have a baby with congenital abnormalities, and there are concerns about the drug going back even further than that. But the kind of things we're talking about, there's an increased risk of spina bifida, of cleft palate, but also things which are less precise, things like developmental delays, things like autism that may develop later in life. So a whole range of symptoms and difficulties, mobility problems, muscular issues. It's really very wide-ranging.
And one of the ladies is called Carol, and she had Sarah back in 1989. And one of the other ladies, Jo, had Lewis in 2005. So an enormous gap between these two children whilst this was all going on, but yet not known about. Why weren't they told about the dangers?
The dangers have been known about. The evidence has been growing over time. But there's a massive gap between when it was licensed and when we really saw kind of strong warnings introduced onto packaging, warning women about the dangers. That wasn't until 2018.
Carol, who, as I say, had Sarah back in 1989, I know that you've spent a lot of time with this family. She said she knew something was wrong. Let's have a little listen to her.
She didn't lay right in the cot or anything. Her legs weren't right. I asked people, no, because you're a first-time mum, you're over-anxious. And they said that Sarah was double-jointed, which was a joke, to be honest with you. I'm angry. I'm very angry. 16 years before my daughter was born, they knew about it and nothing was said, not a thing.
I mean, there must have, when as a young new mum, having that kind of instinct that something is wrong, and then to be kind of pushed away and told not, that's not the case. And yet she has had a child who's grown up with these developmental problems throughout. What is it that Sarah's life is now like as a result, and also Carol's?
Well, she's completely dependent on her mum. She uses a wheelchair outside of the house. She has difficulty walking. She can't cook for herself. She needs help washing. She really enjoys puzzles and she's very positive about life. They have a lovely relationship, the two of them. But Carol's had to give up work to look after her. Previously, her parents were looking after Sarah so she could go to work, but she's lost her parents now, and so she's had to care for Sarah full time. She's really, really worried about help and support being put in place for Sarah, because she says, for how much longer am I going to be able to care for her? I'm nearly 60 years old now. And that's why the kind of impetus for this is becoming even more urgent.
Concerns about taking this drug during pregnancy were first raised, 50 years ago?
Early
Something like
70s.
That? The early
before it was
70s.
licensed, yeah.
Carol had her daughter Sarah 35 years ago. And then this other mum, I know that we've kind of touched on this before, she took it, Jo, without being warned, 19 years ago. Can you just tell me a little bit about what her situation was?
Well, she'd actually had an ectopic pregnancy before, so she'd been in contact with fertility services. She'd asked for advice and says she wasn't warned. And then when she went for her 12-week scan, when she'd fallen pregnant with Lewis, she says she was seen by a specialist epilepsy midwife. I didn't know that specialist epilepsy midwives existed, but she was seen by one who apparently was very shocked to discover that she was still taking the medication. And at that stage, she lowered the dose. But Jo says it was just too late. The damage had already been done.
I find it really, really hard to fathom why these women weren't told.
I think a lot of it is to do with the disjointed nature of the health service. Women are seeing fertility experts, then they're seeing GPs, then they're seeing neurologists. This is epilepsy is a specialist area in neurology. But I've spoken to the Patient Safety Commissioner, and she says really there's no excuse for this, that we should have had a more joined up system. And partly it's because of this disjointed and dismissive nature of the health service, which has led to these messages not getting through.
So who is responsible? I mean, are we talking the regulators? Are we talking, individual doctors in different parts of the country, or...?
In a sense, everybody's responsible.
Right.
I think in the 70s and 80s, there was a very different attitude to medicine. It was far less regulated. Doctors were not, there wasn't this emphasis on informed consent in the same way that there is now. We have spoken to the medical regulator, and they've told us since 1974, product information for healthcare professionals has always included a warning about the risks of valproate use during pregnancy. They do acknowledge in the 70s and 80s, few medicines were supplied with any printed information for patients, and they point to the fact that there have been patient information leaflets in place since 1989. But those patient information leaflets introduced then just said, if you're pregnant or considering becoming pregnant, consult your doctors. Well, in many cases, these women did, and they were reassured.
And even all that time after 1989, and when you spoke to Jo, she had Lewis in 2005, a long time after that, and still not warned about it. I know that you've chatted to Jo, of course, spent time with her and Lewis. We've got a clip of Jo, and she can talk to us about the effect that it's had on Lewis. Let's have a listen.
He's now been diagnosed with ADHD and ASD, classed as disabled. He looks like a normal 19-year-old, but he's not. He cannot process information. He worries all the time. He's so unhappy. He just wants to be able to live the way other kids his own age are living, but he can't because he can't process it.
I mean, it's not much to ask. He just wants to live like other people his age. How many families like Jo and Lewis are we talking about who've been affected by this?
Well, the charity Epilepsy Action put a figure of 20,000 families.
That's greater than thalidomide.
It is,
isn't it?
yeah. Thalidomide worldwide was about 10,000. We're talking about potentially double that. So it is on quite a grand scale, really, and it's amazing that it's gone under the radar for so long when you look at those figures.
Now, my immediate reaction, I suppose, is, well, presumably it's off the market. Presumably nobody takes it anymore. But it's out there, isn't it? It's still there, but now the warnings are known.
It is still on the market and it is still a very effective drug. This is the problem.
Yeah.
For many women, there aren't alternative options. And the advice is that you should never come off valproate just because you're trying to get pregnant. You must do it under the advice of a doctor. And there is something now in place called the Pregnancy Prevention Programme. That's been in place since 2018, which Jo is now on. If you're on this drug now and you're a woman of childbearing age, in fact, if you're a man as well, because it can pass through the male line as well, if you're a woman of childbearing age under 55, there are really strict rules about you taking this medication. But I don't think there's a suggestion that it would be withdrawn from the market because epilepsy is a life-threatening condition. And if nothing else controls your seizures, what else can you do? The important thing is that women know the risks they were taking. And historically, they did not know the risks they were taking. They weren't given choices to switch to other
So it's about an informed choice. And these women that you've spoken to and potentially 20,000 other families were not given the information to make the choice that they wanted. So, I mean, what's being done about it, I suppose, kind of seems like a very, very broad question, and maybe it's not possible to answer, Christine.
Well, there was a big report that was carried out by the Patient Safety Commissioner that published some 16 months ago. It's called the Hughes Report, and it sets out kind of, how families might be helped, what kind of redress we might see. So far, we've had no response from the government on that. They say that it's a really complex issue and they will provide a response at the earliest opportunity, but so far they haven't done that. We understand that meetings are going on between ministers and patient representatives, so we'll have to wait and see what comes out of this. Certainly things are much tighter and much more tightly controlled than they were. And the number of women who are on this drug now has reduced dramatically. And
in your report, you can now actually see, can't you, a silhouette of a pregnant lady on it with a line through it, highlighting the warning that if you're pregnant, this drug may or may not be right for you. What do the families want now? I mean, you talked about the government is looking into it, not done anything as yet. But what do they want? Are we talking about compensation, acknowledgement? What do they want?
Both, I think, and more. I think they're talking about compensation. They're talking about provision being made for those children in the future, so they can be supported and potentially, live a more independent life. I think most women want an apology, and also they want access to healthcare. They want access to perhaps housing or help with perhaps benefits, because they feel like they've been hit by a double whammy in many ways. They're living with a disability. Their children are now living with a disability, and now they're having to fight for benefits, for access to health services, that kind of thing as well. So I think it's a whole range of things that they're pushing for, but the most important one is compensation.
Christine, watching your report on this, I couldn't fail to kind of notice the dynamics between Carol and Sarah and Jo and Lewis. Then when you had this lovely rapport with the children and what they spoke about, I'd really like to listen to a couple of the answers that they gave you.
I really don't really know how I feel about it. It's just a bit sad and it's just mainly sadness I just feel inside.
I did take it as a part of my life. I did get on with it.
I mean, Sarah just says she gets on with it. What, for you being part of their life for a short time, I suppose, doing this report, what was your takeaway from it all, really?
I make of it. It's heartbreaking to see how they're struggling to cope day by day. And the thing that I really take away from it is both of them say they don't blame their mothers, and they don't feel like their mothers are responsible, because there's a lot of guilt around this. The mothers
that was one of the things that really upset me, that all of those mums blame themselves.
Yeah, but the children do not blame the mothers. They're very, Lewis, he also said to me, I don't blame my mum. She was just taking this drug because the doctors told her to. She was just trying to stay alive. He's got that level of kind of love and care and understanding of the impossible situation that his mum was in.
Thank you so much for coming in to talk to me about it, and ultimately, far more importantly, raising awareness about what's happened to these families. Thank you very much, Christine.
Thank you.
And you can watch Christine's documentary on ITVX. It's called Sodium Valproate, A Scandal in Plain Sight. Remember to subscribe to What You Need to Know on your chosen podcast app so you never miss an episode. And you can watch full shows on Spotify, ITVX and YouTube. Until next time though, thanks for joining us.